Why doing veneers? Most patients, even lots of doctors, talk and propose veneers thinking that it's merely an aesthetic solution to improve a smile. And yes, of course, with veneers, we can give you that beautiful smile that you've always wanted. But it's much more than that. There's so many patients that suffer from erosion. There's so many patients that suffer from genetic conditions and have poor enamel. Even functional issues can be resolved with veneers. So it's not only about giving you a nice smile, it's also about rejuvenating your aspect, rejuvenating your function, giving you lots more than just that beautiful smile. I always tell my patients, aesthetics is a side effect of a properly planned case. To talk about the difference between veneers and micro veneers, the obvious difference is the thickness of the restoration, meaning that when we're doing conventional veneers, the teeth needs to be prepared deeper. When we're doing micro veneers, the preparation of the teeth is minimal and sometimes, in many cases, without any prep. So we are respecting much more the biology of the teeth when we're working with micro veneers. This also brings me to think about materials. There's a lot going on about different materials and doctor talking about the difference between milled versus layered handmade ceramics. And it seems that handmade ceramics are supposed to be much better. For me, the reality is that there is just the ideal material for each case. If we have a very small and we need to prepare a veneer where we're adding lots of the missing tissue, probably milled restorations with a cutback and a little bit of layered ceramics will be the best option. When we're working with micro veneers where it's a non-prep, then yes, layering can be the better option. Ultimately, nowadays, with all the technology and materials available for us, we can achieve amazing looking, very natural results with any of these materials. Just pick the right one for the right situation. Let me start by saying that many people ask me why Smile Design Boutique is different, and they ask me, what do you do for a living? And I hate saying I'm a dentist. I like to consider myself more of a smile architect. And that is what Smile Design Boutique is about. It's about reinventing dentistry. It's about giving our patients a place where they can feel at home, not only providing all of the digital technology available nowadays, making their stay in the clinic short, our results predictable, but also making them feel unique and special. My patients are not only patients, they're guests in my house, and me and the whole team are here to make their experience a beautiful one, a seamless one, an experience where that fear of the dentist, for example, can be easily overcome, where they can come for a coffee if they don't have an appointment and steal a little bit of our Wi-Fi. Smile Design Boutique, it's more than a dental clinic. This is a home. This is a special place where we not only give our patients their smile and their health back, but we want them to feel what they are, special to us. Well, yeah, I spoke a little bit before about digital protocols. It's true that here in Smile Design Boutique, everything we do is 100% based on digital protocols. There's a lot of fuss going around with what is digital and what is not. For sure, digital is not buying an intraoral scanner and saying my clinic is now digital. Digital is a philosophy. It's the new way of doing things. There's no escaping advancing and the advances we have in the digital world nowadays, not only in dentistry, but in any other science and any other profession. And of course, for dentistry is the same thing. By working with 100% digital protocols, what we are doing is becoming fast, becoming precise, becoming predictable in what we do. Ultimately, what we are making is the life of our patients easier. We are communicating better with our technicians. And we're making all of this happen in as little as 2 appointments, thanks to all these digital protocols. Digital dentistry is a philosophy. The whole team needs to understand it. You have to work with a lab that understands these digital protocols. If one bit of the chain is broken, we are no longer digital. We become an analogic clinic, like sadly, most of the clinics are out there. One take, beautiful, I love it.